Health insurance open enrollment is coming up for this fall for millions of Americans. Here today to provide us with tips on how to pick a health plan is Michael Magario, an executive director with United Healthcare. Michael, thank you for joining us all today. First of all, I think health insurance is incredibly confusing for a lot of people. So let's just start with the basics. What is open enrollment?
Open enrollment is the time each year where people have the opportunity to select or switch their health plan. Enrollment periods aren't the same for everybody, so there are a couple of things you should probably keep in mind. If you get your coverage from your job, which is where most Americans get their coverage, almost 180 million people, most employers set aside a couple of weeks, typically between September and December, that they call open enrollment. If you have Medicare, it's much more precise. There's about 64 million people enrolled in Medicare, and the Medicare annual enrollment period runs from October 15th to December 7th every year. And then lastly, if you buy your coverage from an individual state exchange, those can vary a little bit, but also generally will run between November and December in most states.
So how has technology really improved the ability for the public to find quality physicians and helped with price transparency?
Yeah, I think for too long, people have had little or no access to information about either quality of the outcomes or the costs associated with visiting a doctor or a hospital. And this lack of transparency costs our health system billions of dollars every year and leaves individuals kind of in the dark about their own options. And I think this has changed lately. Now, with only a little bit of effort, there are a lot of resources people can use to find information on both quality and cost. At United Healthcare, we have our mobile app, pretty precise. You can find quality information on your physician and on your hospital. You can find cost information, and it's customized to you and your health plan and based on the actual rates that we have with those care providers and facilities.
What would you say are some tips to help people pick the right plan or maybe even save some money on their health care?
So my first tip is look at all your options. So you need to take a little time to understand and compare the benefits and the services and the costs of each of those plans so you can figure out which one will work best for you and your family. My recommendation is look back over the last year, see what kinds of services your family used, and check on those things for next year. That might be prescription benefits, might be doctor's offices, or something more specific if you have a chronic condition. And increasingly, people are checking for mental health coverage. In addition to in-person mental health care, you might have access to a large network of virtual therapists and psychiatrists. And related to that, as we all learned in the pandemic, you should look closely to see if your plan covers virtual care services. Those virtual visits can be more convenient, they can be cost-effective, you can have 24/7 access to care for everything from wellness visits all the way up to urgent care and chronic condition management. And then last but not least, don't forget about all the other benefits that are offered to you. They're called ancillary benefits usually, things like dental or vision or critical illness plans. Those are frequently available to you also, and they can do a lot to contribute to your family's overall well-being.
For more health insurance tips, visit uhcopenenrollment.com. There you'll find easy-to-understand videos and articles that will help people better understand health insurance and prepare for this open enrollment season.